It's guns, knives, and watches, baby, and I can't be guns, knives, and watches right now because I have to show you the kit that actually keeps me alive and keeps me put together. And it's really just a few items, and then you integrate other things into it. But in reality, I start with the same kit everyone else would. Flexible fabric band-aids. These are 1 inch by 3 inch, pack of 100, fabric, da. They do all kinds of it with them, and you can see they're almost gone. Which this is a new box. This is not. So I get injured a lot. It's just the way it is. You can also use them Curad flexible H-type bandages, which man are also, man, they just work, man. You get her done, and they're. You can get more expensive ones, but this is the cheap ones that are worth enough to actually purchase. They're 1.5 by 3. And do I like these as much as those? No. If I was going to buy one, I would buy these, of course, because even like on a hand like mine, it works. Another type of a bandage or some type of dressing is a Steri-Strip, okay? And of course, these are 1/4 inch by 3 inches long. You buy them in a pack, you open them up. You're going to get 3 of them. Of course, these have already been opened. No, these have not been opened. I just opened them. Oh, good for me. There's 3 of them in the pack. You can cut them long ways, make them 1.5 inches piece. You can use individual ones by cutting them across. And then there are serrations on both ends of the paper that help you to actually apply them. And you can go, and I'll see what I can do. This is a Steri-Strip. It's a 3.5 inch Steri-Strip. And do you care if these are no longer sterile? Fuck no. I'm going to show you that here in a minute why you don't give a shit. And you can put those on that wound, pull it a little tight, lock her over there, and then put her down, baby, like that, baby. Woo-hoo-hoo-hoo, and it holds that thing tight, baby. And that was this exact 3-inch Steri-Strip, of course, cut in half. And then I cut it down each one when I use them individually. And then that actually makes those things work. So we got the Steri-Strips. We have the Band-Aids. Now, there are 2 types of antiseptics that I actually use. Povidone-Iodine ointment, 10%, which they say maximum strength first aid antiseptic. You can use this on wounds when you're doing surgery, when you're doing anything. A more common name is betadine, and the reason you don't give a shit whether these are sterile or not, because you're going to actually put this on the wound, and then you're going to cover with a Band-Aid after that, you know what I mean? Another great one, because I use this in the earlier stages of treatment, are these little packets of polysporin, and I buy these in large quantities. As you can see, everything here is huge quantities of everything, because I use them so often. I use them in so many different ways. I use polysporin basically because it's, number one, it's the most usable. It's way more usable than that triple antibiotic ointment, whatever the hell they call that crap, and then Neosporin, and it's also less allergic if you're going to treat somebody else. Of course, you can get it in tubes, and you can get it in whatever the hell you want to use it in. There's another one, Povidone-Iodine. You can tell we use this shit all over the place. Another good thing are these. If you're going to get some type of non-adhesive dressing, these 3x4 Telfa pads are actually the ones that I actually recommend. They're the only ones I would use, and everybody else can go blow me. If you think you got a better one, suck me. It's just really, everybody else's crap sucks, and it's just that way. And of course, you can sit there and see that I've got all kinds of I've got Steri-Strips in here, and then Telfa pads and all this there, the other. And really, believe it or not, this is my go-to first aid kit, and I'll keep things to where I've got some Band-Aids in here with these, and da-da-da-da-da, and it's just the way it is. And these are my go-to things that actually keep me going, okay? Keep me actually operational, because that's that in the end of the day works. And I've been able to do what would cost me, tens of thousands of dollars normally by not getting infections, not getting this, that, or the other, not having to fuck with stitches and everything else. And I know that's not the prettiest wound in the world, but fuck it, it's this, that, or the other. Now what this is not is a trauma kit, and this is a trauma kit from ITS Tactical, and of course everybody knows fucking, give me, blow me, okay? So you can do stuff like this. Of course it's got, it's got that there needle, man, that there lubricating jelly, just in case you have one in there. Have to put them there airway passage thingamabob down that there do, man. And it's got a decompression needle and all that crap. And I'm not gonna go through this particular kit. And you can learn more about those from somebody else, because that's really way outside the scope of what I'm gonna talk about, because I'm just not gonna talk about it. My med kit that I actually carry in my backpack it's a combination hygiene kit, and it's also a first aid kit. It's also part of my shit happens kit. Of course, you've got the moleskin that I buy in these big ass rolls, about 2 inches wide, and you can figure out, you can learn about those, and band-aids and pads. And of course on the inside of that, I've always shown, there's always money. You gotta have money. Money can get you out of more fucked up problems than you can shake a stick at, and it can even deal with your health care in case you're somewhere and they don't take your insurance or something like that. What you're going to notice here is, you're going to notice on my backpack I have another large Povidone-Iodine. I have a Benadryl cream. I have just some Imodium in case you this, that, or the other. And then this is where the dental floss is also for sewing up. I can use this even though it's got an odor to it, and it's mint. Might burn like hell, but you can use it for sewing up things. Of course, you got some little pins and needles and that kind of stuff, and just some bullshit. But what you're going to see, basically the same things that were in my home kit, because they actually work and they can keep you operational, along with things like moleskin, along with things like you still have your polysporin, you still have your quick clot, you have a bandage here 3 inches wide. I just like them that way, as sterile gauze. We still have our Steri-Strips, we still have our Telfa pads. So basically that kit is the same as this one. Of course, I'm showing you the tape in here, and this is first aid medical tape that's been taken off of the actual container, and then there's quite a bit of duct tape there that can be used for all different kinds of crap. And then we've got, of course, things like Gold Bond, medications, thermometer, earplugs for whatever. And then these little Q-tips. These Q-tips can be really good for cleaning out wounds and using for a lot of different things other than cleaning out your ears. But in reality, the things that actually keep me going, other than the tape, because the tape's always necessary, and a roll of bandage, and also some quick clot, is basically the same things that I'm going to have in my home kit. Because my mind, unfortunately, I'm not smart enough to reinvent the wheel and to do things differently out in the field than I would basically do them at home. So if I'm going to do something at home, I'm going to do it the same way. And you'd be amazed how severe cuts you can actually deal with. And of course, I could leave these full length 3 inch and wrap it all around, wrap it back on itself. Or I can do it, a lot of different ways. The thing you have to do is always keep these dry. But it gets down to polysporin, Povidone-Iodine or betadine, a couple different types of band-aids, and Telfa pads, and you're going to be able to, with some of the things that are around you and some of the stuff that you have as far as your dealing with allergic reactions for your Benadryl, as far as this, as far as that, this is going to get you, believe it or not, through more things, especially with these damn Steri-Strips, which I'm a huge fan of, if you can't tell, are going to save your ass in a situation where you cannot get medical care, where medical care is cost prohibitive, because this will actually cover a lot of different wounds, a lot of different things. Is it going to cover if you get shot in the chest, a big sucking chest wound? No. Is it going to deal with you lose, a lung, you lose compression between your lung and your upper thoracic cavity? No. Is it going to deal with a lot of other crap? No. But you pair it with a few different things that you have in your kit, as far as quick clot, as far as this, as far as that. And you can go to the extent of having something like a trauma kit, which is dedicated dealing with weapons type things. And you can go to get things like a tourniquet. But what's the reality of the things you're going to deal with every day? What is the reality of your life? This is the reality of my life. Even in hostile environments, even in all different kinds of shit, I can do a tremendous amount with this. This is Guns, Knives, and Watches, and this is my philosophy of first aid and some of the things that I value. Have a good one.